Chris Lane is the president of Buffalo General Medical Center and the Gates Vascular Institute. He and his team have been on the front line of COVID-19 for the past 5 months. He stopped by today to join us and talk a little bit about the coronavirus and how it's impacting his operation. Chris, thanks for joining us today.
Thanks for having me, Mike.
So as I was saying, we're almost reaching 6 months now, so nearly half a year in dealing with not only the pandemic, but, the fallout from that. So if you can, just kind of take us through where you guys are right now operationally as a hospital as we hit August versus where you were, say, in the peak of this.
Sure. So we started the year really strong from a volume standpoint. January and February were really rock solid for us. A lot of people coming to the hospital, and COVID hits, and obviously we saw a huge decline. A lot of volume moved away, just really kind of evaporated. We saw a lot of COVID patients here through the months of March, April, May, and into the early parts of June. But we've seen a real rapid decline of that, like we've seen throughout New York State. We've seen that same in Erie County as well. And we're seeing the resurgence of our business, which is great to see. We had seen such a decline of emergency room visits and a decline of surgical visits, and we've seen that resurgence, which is fantastic for us and really fantastic for the community, because that's what we're here for.
Sure. Before we get into the resurgence, I do want to talk a little bit about COVID-19. So at the peak between your facility, Buffalo General, and Millard Suburban, I believe you guys were in somewhere in the 160 range in terms of patients who have been hospitalized with COVID-19. What are your numbers looking like now from a percentage? Are you down to about 10% what you had, 20% what you had? Give us a sense of where you guys are now.
Yeah, so from a system standpoint, we were around 160 on a daily basis. Buffalo General, we were around 100 during our peak on a daily basis in-house out of our 500 beds. So a lot of patients with COVID were in the hospital, and we had about 10 nursing units. Today, we're down to 7 patients. When I looked at the report this morning, we're down to 7 patients COVID positive in the house. And it's not a lot of folks coming in. So we've held that 7 to 8 to 6, right around that range over the last 2 weeks. And they're not critically ill patients either. So we're seeing a real great job by the community from the social distancing and the masking, and it's paid dividends for everybody in the community.
And so, Chris, do you and your team expect those numbers to continue to hover around the dozen or less throughout the rest of the year? How are you guys planning for that? And what kind of outside factors would impact that number?
So obviously we plan for a resurgence of COVID patients. We're hoping for no more, but we're hearing throughout the nation that there could be possibly a second wave. We're not seeing that, which is great. But we are planning for that. So we are planning that we may see a second wave, and we're, ensuring that we have the proper equipment and ensuring that we have the facilities and the staff available for that. We're not seeing it though. Like I said, we're seeing 7 to 10 patients with COVID on a daily basis. So it's really, truly business as usual for us right now. And we're planning for business as usual, but we're also planning if that resurgence does occur from a COVID standpoint, we're going to be ready for it.
You mentioned the staff. As we had it now, we're in August. The coronavirus hits in March. You get your first inpatient or your first positive patient. And so really for that time, the past 5+ months, really had a deep impact on your staff. If you can, your thoughts and feelings about the staff at Buffalo General and the Gates Vascular Institute.
Unbelievable. I truly cannot, I was speaking to some community groups the other day, and they truly are heroes. When all gets said and done and the dust settles, when you see the results that our staff and our physicians and our hospital had come through this COVID, it's absolutely amazing. The things we have done here, the type of trials we've done here, the convalescent plasma, remdesivir, the hydrochloroquine, everything we've done here really on the cutting edge. And you think Buffalo, New York, how cutting edge is it? We're in the cutting edge of any hospital in the nation, from the treatment and from the care of these patients. And the results we've seen could, marvel hospitals throughout the entire country. So once the dust settles, we'll be able to have some publications with regards to that. And it's all because of the great staff and the great work they've done each and every day to ensure the patients are at the forefront of everything we do. This is just really the work they've done is remarkable.
So in saying that, having COVID-19 come through your hospital or the community the way it did, there's a fallout to that aspect in terms of, the entire focus of the hospital is to make sure that you can take care of those positive patients, especially as this was going through its peak. But there's the natural financial fallout based on the fact that you had to empty out your hospitals. Let's start with the front end of the hospital. What has it done to the emergency room? And then what are you guys doing now in terms of a go forward look?
So when COVID hit, a lot of folks did stay away from the hospital who didn't need to be in the hospital. So our emergency room saw about a 40% decline in business. We've been bouncing back, which is great. So our emergency room used to see maybe 180 to 190 patients on a daily basis. We're up to the 160 and 170. So folks are coming back, and that's important because that's the portal for folks to get the immediate care they need. So we're happy to see that occur. That's what we're here for. The staff is just invigorated by that. So while we were caring for the COVID patients, everybody was so busy and so focused on the patients. It's the same thing now. They continue to focus on the patients, but they're focusing them in a different way. So it's not the COVID patients coming in. It may be the cardiac patients or the stroke patients or the orthopedic patients coming in. The same focus is still there, and that's the focus on the patient, each and every patient, each and every encounter.
Another aspect of your business that was hit by this was your ambulatory business, your outpatient business, the clinic business. Tell us a little bit about how that affected you. What were some of the measures that you took to try and keep that connection with your patients throughout, and how that business may be coming back?
Yeah, so we have a number of ambulatory centers within the hospital and within the community that flow through Buffalo General. We've seen some good results with relations to telehealth. So there's a lot of visits being done via Zoom or being done telehealth or telephonically. That is paying great dividends for our community because it's getting the care that a patient needs without having them come into the bricks and mortar facility. Some folks may still be concerned about that. And we want to really dispel, first of all, that's not the fact. Really, you come to a hospital and you come to one of our clinic settings, it's safer than going into your supermarket or going into anywhere in the community. It's the safest place to be because our rates of infection are so low within the hospital setting and visitors coming in. So everybody's very, very safe here. But if folks want to stay out of the hospital, if folks want to have their treatment done at home, we have that ability through telehealth, which we didn't have before. And it's really revolutionizing the care. So folks can stay at home while still receiving the great care from our practitioners who either reside at the hospital or reside at one of our clinics.
So I'm going to ask you about that notion and that, thought that it's not safe to go to the hospital because COVID-19 is there. And you talk about it's the safest place in the community. Explain to those who are watching, why is that the case and why should people be confident in their care when they come to Buffalo General?
So community spread of COVID-19 during the peak was over 4%. Our spread within the hospital was less than 50% of that. And the reason being is, we were at the forefront of ensuring the safety of our staff, the safety of our visitors, the safety of our patients. So before you even step foot in the door, you'll see that. So every single person coming into this hospital has their temperature screened every single time they step foot in the building. It's a mandatory masking as soon as you walk into the building. So everybody has to have a mask on as soon as they walk into the building and throughout their entire time within the facility. In addition to that, the restriction on visitation has really ensured that we are containing as much as we possibly can within this hospital. So bringing outside folks in the community in has been mitigated to certain hours of the day. In addition to that, you can't walk 6 feet within the hospital without having a Purell hand sanitizer at your beck and call. So really, you mask, you're washing your hands, you're ensuring the safety of everybody. We did it before it was even really put out there in the community, and it's paid itself dividends greatly. So you come into the hospital, you are very, very, very safe. And that's what we want to continue to tell folks. Come to us. We're very safe. You're going to get the care you need. Do not sit at home for that.
So probably most prominently, the group that is coming back into the hospital is the elective surgery cases and surgeries that were put off during COVID-19. That obviously took up a lot of attention, knowing that people had to put their care off, whether it was, for cardiac procedure, neural procedure, orthopedic procedure. The elective surgery issue was a pretty hot button back in the late spring. Those procedures are starting to come back into your facility. What are you seeing in terms of volume? What are the patients saying when they come in to get their surgery done?
So, just like we've done from the masking and the hand washing and the ensuring safety, we do the same for our elective surgery. So we're up to over 90% of our capacity from a surgical standpoint now. So we're seeing great results. And like I said before, the resurgence of these cases is coming back, which is important from a community standpoint because so many folks in the community rely on our surgeons and our care here to get better and to really get back to life they want to live. So before they even have the surgery, every single one of the patients requiring surgical care here does have a COVID test. So we want to make sure prior to them receiving the surgical care they need, they are cleared from a COVID standpoint. So they're safe, obviously themselves from a COVID standpoint, but also the staff in the hospital and any visitors in the hospital as well. So we take that extra precaution to be sure any patients having surgery has a COVID test before the surgical case occurs.
So Chris, as you look out the last 6 months of the year, or that second half of the year, as an administrator, you see infection rates are dropping, hospital rates are dropping, hospitalization rates are dropping, but you still have some, headwinds coming at you. As the hospital president, what concerns you and what are you looking at as you look at the second half of 2020?
So obviously a second wave of the virus would obviously concern me. But like I said, we're preparing for that. We prepare for the worst and really hope for the best. But hope isn't a strategy from our perspective. So we're preparing for that second wave and we're hoping it isn't going to occur. But if that second wave hits, there's a few things we've done in place to make sure, first of all, we're prepared for our community. Our hospital staff will be safe. The community will be safe. They can continue to utilize us as a resource and continue to come to us as a full service hospital. So we've put mechanisms in place if we do see a second wave that we can continue our surgical volume because it's really important that our community has that ability to have their surgery done here on a day in and day out basis. And we wouldn't need to slow that down or stop that in the safest manner possible. So we are ready for a second wave. I'm hopeful it does not hit, but we are ready and we're prepared for our community and our staff will be safe and our community will be safe. And, like I said, hopefully it doesn't hit, but like I said, we are ready for it.
Chris Lane's the president of the Buffalo General Medical Center and the Gates Vascular Institute. Thanks for joining us today on Medically Speaking.
Thanks so much, Mike.